Dr. B here in our series Demystifying the DSM, and we are on psychotic disorders. Today I'm going to be talking about schizoaffective disorders. So if you came across this just in like a search for schizoaffective disorders, it's going to be important to also look at the schizophrenia video and either the bipolar or depressive videos, because schizoaffective brings in kind of those symptoms. And if I'm talking to practitioners, you know, the differential diagnoses here sometimes gets confusing, and I have seen people putting schizoaffective, and I might have said bipolar with psychotic features. You know, and so you will see differences in diagnoses among providers. And to our clients that are listening, that's okay, right? Unfortunately, mental health is not as black and white as other symptoms in the body, right? Our neurological system and how we present has a lot to do with our environment, how we're raised, our cultural things. You know, in schizoaffective is basically saying that you meet that first criteria for schizophrenia. So go back and look at that. That's you have to have 2 of one of these 5 symptoms: delusions, hallucinations, disorganized speech. You have to have at least 2 of those. So you're meeting that basic criteria for schizophrenia, but then there's this concurrent mood piece, right? So affective means mood. Schizo means schizophrenia, and affective means mood. So schizoaffective means you are meeting that basic criteria for schizophrenia, but maybe not the negative symptoms or the severe functional decline that you see in schizophrenia. But there's this strong affective component that is there even when we get the psychotic piece in remission. So when we're treating someone with schizoaffective, we are treating the psychosis first and then the mood second. So oftentimes you'll see the psychotic symptoms decrease, and then we have to maybe add an antidepressant or do something specific, or like an anticonvulsant or a mood stabilizer to treat the affective part. So in schizoaffective, we have 2 types. We have the bipolar type. So, you know, go and look at the bipolar video, which I haven't done yet, but it'll be in the series, and the depressive type, okay? So that means that they're meeting criteria for schizophrenia part A, and they are meeting criteria for either bipolar or depression. And that's how we get that schizoaffective diagnosis. But don't be discouraged if you are someone who is diagnosed with that and you're like, well, but somebody else said I was bipolar. The reality is here at Mentally Strong, we treat symptoms and receptors, not DSM diagnoses, because DSM diagnoses are really just a cluster of symptoms that don't necessarily go with our neurological circuits. And remember, when we're talking about psychotic disorders, we are likely going to have to treat it with medication. So here at Mentally Strong, we are going to take that schizoaffective diagnosis and look at you personally and say, what symptoms are you presenting with, and how can we treat those? And honestly, we might treat someone with, you know, bipolar psychotic features with some of the same medications. So don't own your diagnosis as who you are. Just know that these are the symptoms that you are presenting, and psychotic symptoms need to be treated with medication. The affective part of what's going on, the bipolar, depression, maybe you've experienced trauma, that's going to be treated with a Mentally Strong method. And schizoaffectives can, you know, learn to function and be, you know, especially with medication and therapy, and, you know, function and get control of those symptoms. So that's how we do it here at Mentally Strong. We do it with medication and counseling.